we need to consider the possibility that there could be additional cases, particularly among the healthcare workers who cared for the index patient when he was so ill. That's when this healthcare worker became infected, and we're concerned and would unfortunately not be surprised if we did see additional cases in the healthcare workers who also provided care to the index patient.
That was CDC Director Tom Frieden addressing the possibility of more Ebola cases being reported in the next few weeks. The weekend discovery that a Dallas nurse who'd cared for a now deceased Ebola victim had herself contracted the virus has prompted U.S. health authorities to give serious thought to how the nation goes about monitoring and containing it. Dr. Frieden said Monday that the agency was rethinking its approach. You're with the News Hub. Good morning. I'm Michael Casey. Thanks for joining us. With more on how this gathering healthcare crisis is shaping policymaking, we're joined, as we were yesterday, by WSJ Atlanta Bureau Chief Betsy McKay. Good morning, Betsy.
Good morning, Michael.
So what are the key points here? What does Dr. Frieden say needs to change?
Well, he said, you know, the agency is rethinking its approach, and that's a little bit different from what the government has been saying earlier. You know, they feel there's a need to look at not just the guidelines, but how their guidelines are implemented by hospitals across the U.S. I mean, this is difficult. These are difficult things to do.
Right. I mean, that difficulty seems to be a key point, obviously, because there's compromises that need to be made. There's balances in terms of cost and the use of resources and so forth. You know, talk that through if you don't mind, how, you know, they've got to get this balancing act right.
Sure. I mean, you know, like I said, it's complicated to take and difficult to take care of Ebola patients. You have to pay a lot of attention to wearing protective gear correctly and the type of protective gear you wear. So some of the things that, you know, the CDC has said they have pretty good guidance for hospitals. But one question is, are hospital workers well enough trained? I mean, it's not easy for any hospital to do this. So they're stepping up training and outreach to hospitals. The other thing that's interesting is they said they would consider some steps that are taken in Africa, but not necessarily the U.S. For example, in Africa, after you've come out of a treatment unit, you get sprayed down by decontamination workers. They actually, you know, spray your whole suit to kill the Ebola virus before you take the suit off. That's something that they might look into for this particular hospital. They also said, you know, their guidance is kind of one size fits all, and may be tailored a little bit more for individual cases.
You know, there was an issue yesterday with the nurse's dog, which I think seems to be an interesting case in terms of the potential for overreactions and how, you know, what sort of decisions are being made by authorities. Tell us a little bit about that, if you don't mind.
Yeah, I mean, it's interesting. This nurse has a dog, and the nurse's aide in Spain who developed Ebola has had a dog who was unfortunately euthanized. There's a lot of emotion around pets, as everyone knows. There was a big, you know, outcry over the plan to euthanize the dog in Spain, which unfortunately did happen. Officials here say that with this dog, they are looking for a way for it to be taken care of while nurse Nina Sam has been treated. You know, the big question is, do animals carry Ebola? The studies that we found yesterday, you know, found that even those who were infected did not become ill. They developed antibodies to the virus. So, you know, it seems in this case that the Dallas officials are taking a pretty prudent case, watching the dog, but mostly making being cared for rather than euthanizing it.
All right, Betsy, thanks very much. That's the hard-working Betsy McKay. Keep up the good work.